Dr. Quinn, what are the best ways to keep your sanity while keeping your distance?
Well, I have 3 recommendations. Number 1, it's a good idea to maintain some routine with objectives every single day. I know a lot of people are at home. I advise everyone to get up every morning, take a shower, get dressed, and carry out your day. If you are working from home, do your job. But if you're not working from home, hey, there are a lot of things you've always wanted to do. Try to accomplish them, but have an objective every single day. Number 2, stay connected. A lot of people confuse social distancing, social isolation. You want to realize you're not isolated. Call loved ones on the phone, FaceTime, use platforms such as Zoom. And I want to announce that the Mayor Lamamba, he is so wonderful. He started a call line where individuals can call in from the city of Jackson if they have depression or anxiety, and they can talk to a healthcare professional, or if they choose, they can even speak to a pastor. Lastly, we want to maintain good lifestyle choices such as exercise and diet, and these suggestions, they can help us get through this time.
I've heard psychologists tell people to avoid fillers. What are fillers in this case?
Well, some bad fillers. A lot of my patients, as I do the telemedicine over the last few weeks, they're telling me, Doc, I'm eating too much, I'm watching too much television, playing too many games, too much social media. And like my wife, a lot of my patients are telling me that they're doing a lot of unnecessary purchases on the internet. Let's try to stay away from those unhealthy habits, because it's very easy right now. I mean, we're very vulnerable with all this free time on our hands and this anxiety. And I even have some patients telling me that they're drinking a little bit too much. I really suggest to stay away from the alcohol and unhealthy habits, and let's just monitor ourselves and monitor the ones we love.
Yeah, lay off the day drinking. Do you believe we've reached a plateau in this pandemic?
It's hard to say. I've been looking at a lot of data from a lot of different countries, such as China and throughout Europe, and it's getting a lot better in these places that started a lot earlier than we did. But the deal is, we just have to stay focused and try to maintain social distancing, but at the current time, it's a little early to make that call.
Do you think it's reasonable to lift the statewide shelter in place on April 27th? That's this coming Monday.
That's a hard one. I mean, there's a lot of debate going out all over the United States of America. Government leaders, the governors and the mayors, they're going back and forth. I mean, the number one concern is public safety. That's more important than economic development. Public safety is number one. And as a physician, I just remind everyone that the best way to avoid catching this virus is to limit your exposure. So if your area or your city opens up, restrictions, still maintain social distancing as much as you possibly can. But I do have some good news. FDA approved a test that individuals can take in their homes with a doctor's order called the Pixel test. And basically, the doctor orders a test, it goes to the home, the person does it themselves with the nasal swab and gets their result in a few days. This is going to be very strategic. It's going to be very great to help individuals be identified that have coronavirus, and we can isolate them from the public, and that'll help in the safety so that we can get through this time together.
All right, could be a game changer. Dr. Timothy Quinn, thank you so much for taking time from his clinic in Richland this afternoon to speak with us. Dr. Quinn, thank you for your time, sir. You're watching 12 News at Noon.